Hi everybody, Mary O'Keefe here from the European Pain Federation EFIC. Today I'm delighted to be joined by Andrea Avers to give you a teaser of her talk at next year's 2022 EFIC Congress. So Andrea, thanks so much for agreeing to be interviewed.
Thank you.
Do you want to start by introducing yourself, please?
Of course. I'm super happy to be here and to introduce myself for the next interesting and exciting EFIC conference. My name is Andrea Avers. I'm professor of health psychology at Leiden University, the Netherlands, and I'm studying psychological factors in health and disease, in particular topic also in chronic pain.
Great. And what do you plan to talk about at the EFIC 2022 Congress?
At the EFIC Congress, we will focus on our online applications, innovative tools, how we can support self-management in chronic pain patients. For example, we developed several web-based interventions where we can work on the support and coaching of chronic pain management. And this has been applied in several types of patients, for example, in chronic inflammatory arthritis, but also in fibromyalgia patients. And so these are programs that can be applied to many different chronic pain conditions. And they're also focused on many different goals in daily life, like disability changes, pain, fatigue, psychological consequences. So I will present some unique opportunities how we can support people and patients in self-management.
And can you give us an insight into some of these applications, how they can help self-management among people with chronic pain?
Yeah, what we see is that there are many patients that suffer, of course, from low quality of life, disability, fatigue, and particularly also the consequences of chronic pain. And this type of programs help to change these self-management capacities of the patient and to increase their possibilities to cope with their condition in daily life, and directly focus also on pain sensitization, disability, and fatigue. The great thing about these programs are that they can be applied online, so we can help many patients in the country, and they can be tailored specifically to the problems of the different patients. So, for example, there are modules on fatigue, there are modules on disability, there are modules on social support, and the therapist can really tailor the specific applications to the goals of the patients. And that is what we see is necessary in the chronic pain management.
Perfect. And what do you see as the main challenges for you and your research group to ensure the implementation of these online tools into clinical practice?
Yeah, this online tools implementation is, of course, that they should be available. That first, for example, healthcare professionals should be trained, and this training should be available. The programs should be easily accessible for many international therapists. Also, what we see now is that specific countries or specific research groups develop specific programs, but usually that the implementation is quite challenging. Also, for example, due to financial problems, that there's no insurance or other possibilities in their organizations, then the whole healthcare organizations have to be also in favor of online treatments. And of course, it should be also, they should also reach the specific patients. So there should also be possible to tailor them to the specific needs and problems of the patients. So the challenges are on multi-levels, that you not only have to reach the right patient group and adjust the treatment to the patients, but also to train the healthcare professionals and to prepare a healthcare organization to offer these online treatments. So it's wonderful to see what we have developed already, we and others, on online tools. And these tools can be applied for psychological support, for disability, for lifestyle engagement, and so on. But the implementation of these tools, particularly on a large scale and internationally, is really a large challenge at this moment.
And would you be confident that we could overcome these challenges?
Absolutely. I think COVID-19 was a perfect example where we immediately changed our consultation in many online consultations, but usually then only in video consultations and not in really digitalized, standardized programs that can support our patients. So now it's next step to really make available the standardized and digital tools that patients can use in their free time, for example, with a mobile phone the whole day, that the healthcare professional can easily be accessible for him or her in the hospital, and to make it really something that everybody can use in the day-to-day treatment.
Great. And in the future, if you to think blue sky thinking, what do you think these applications could be really capable of on an individual level for a person with pain?
Yeah, there's several advantages of digital tools. The first is, of course, that you have a digital tool the whole day. It's not only that you have one consultation once a week and then you have to do everything on your own. No, with a digital tool, I can support my patients with specific exercises, practices, homework assignments. So you can always also interact with your patients. So it's much more effective, of course, if you can follow your patients during the whole day. A second advantage, for example, is that you do not have to wait in a hospital. You have to come to the hospital. It's always available. And of course, for the younger generation, the online tools, it's really something what they're doing the whole day. So it's really important also to incorporate these type of tools in, for example, the social media use and their daily routines. So it in this way, we have so many more opportunities and possibilities with the digital tools that I expect that treatments will become much more effective if we combine them, of course, also with this face-to-face treatments.
I agree. I think it's very exciting because it will give people more access where there are waiting lists across Europe and the world.
Absolutely.
Okay, that's great. Thanks so much, Andrea. So for those listening, if you want to join our next EFIC Congress and hear from Andrea and others, the good news is tickets are now available and you can visit the www.efic-congress.org website to get your tickets. So thank you. Bye.
Thank you.